Report from Santa Fe is made possible in part by grants from the members of the National Education Association of New Mexico, an organization of professionals who believe that investing in public education is an investment in our state's economic future, and by a grant from the Healy Foundation, Taos, New Mexico.
Hello, I'm Lorene Mills, and welcome to Report from Santa Fe. We have two outstanding lawmakers as guests today. First, we have Senator Gay Kernan, a Republican from District 42, living in Hobbs, and that represents Chaves, Eddy, and Lee.
Yes, that's correct.
And Representative Debbie Armstrong, Democrat from District 17, Bernalillo County.
Yes, in the North Valley.
And the North Valley. Well, thank you both for joining us. We are filming it. This will air at the halfway point of a 60-day session. So we're going to look in depth at some of the issues that you are working so hard on, knowing that we don't know how things are going to turn out. What we want our audience to do is to be aware of some of these issues. And if you're drawn to them, pay attention. You can watch it on the webcasting. You can come down to your capital and see good government in action. Gay, let's start with you. You have been here since 2012. Tell me a little. 2012, 2002.
Actually, 2003 was my first session.
Okay, so it's 14, 15 years.
Yes.
And tell us about your background. I know you've been an educator for years.
I have, and I'm from southeast New Mexico, from Hobbs, and I taught school for, in total about 20 years, and my last opportunity to teach was in the Hobbs School District, and I taught first grade, and also worked on the pre-K program, which we helped establish pre-K in Lee County during that time. I retired in 2010. I'm a small business owner. My husband is a physician. I have one daughter and a granddaughter who live in Austin.
Well, you have just the threads of your educational background and then your health background, because you've been on interim committees serving in these areas.
That's correct.
We'll come back to what you've learned in that, because, Debbie, can you tell us some of your background? You are the chair of the House Health and Human
Services Committee.
That's a big job.
Yes.
And Vice Chair of Rules.
Right.
So talk a little about your professional background.
Yes, so I've been in healthcare for more than 40 years as a physical therapist, which I finally gave up my license at 40 years, but I practiced a long time in every kind of setting. But I went about over 10 years ago, went back to school to get my law degree so I could work on health policy. And then I was the secretary of the Aging and Long-Term Services Department for 4 years, in 2004 to 2008. And since then, I've been a small business owner doing consulting and primarily overseeing the New Mexico Medical Insurance Pool, which before the Affordable Care Act was how you could get insurance if you were an individual with a pre-existing condition.
Yes. Well, it's... With that background, we have a lot of concerns at the national stage if there will be a repeal of the Affordable Care Act. And so a lot of people are very concerned about that. In our state especially, because 300,000 people were given medical coverage when this administration accepted the expansion of Medicaid. Mm-hmm. So can either of you get out your crystal balls and see how we can be prepared if this happens?
Well, and I'll start because I think probably Representative Armstrong has a real good feel for that going forward. But as a wife of a physician, I certainly understand that there were some issues with the Affordable Care Act that I think have not been conducive to really providing the best health care. And one of those issues, in my opinion, is the electronic record that they're required to keep. The time that's required to participate in that and to do that is really quite overwhelming, and I'm not sure that the outcome is what we really want it to be, which was the transferability of information from one site to the next. We're not there yet. But the time, if you really do a good job with regard to the health information with that record, you have to go outside of the template and you have to fill in the blanks around that. So to me, that's one area of the Affordable Care Act that needs to be addressed. But it is concerning. I know a lot of money has been raised with regard to providing the care for that I think it's going to be really difficult to pull that money back. And so we're going to have to figure out going forward how we can make sure that people still receive care, but make the tweaks that need to occur with regard to the Affordable Care Act.
Yeah, and I don't have a crystal ball for exactly what's going to happen with the Affordable Care Act, but there's no doubt it's under attack and review. I don't think that people should panic, because I don't think anything can happen overnight. Even if they repeal it, I think that will take a process, or changing regulations will take a process, but certainly there's a lot of things on the table about pieces of the Affordable Care Act, whether it's Medicaid and whether they should block grant Medicaid to the states, or increase the use of high-risk pools, or change some of the regulations of what's required, a mandate. I think there is a commitment that people with pre-existing conditions should in some way be able to access health care. I see that as a given, but exactly how it will work. But I think what's really scary for people is the uncertainty. Mm-hmm. And not knowing exactly what's going to happen, and how do you prepare for that. And so I think one way that I would like to see us prepare for that is actually the bill for the Health Security Act, which I'm not convinced that that's necessarily the right healthcare system, but part of that bill is at first really doing an in-depth study of where we're spending public dollars on healthcare and how we might streamline that system and make the best use of the dollars that we have. And I think that part is really important. The bill itself repeals if we decide it's not affordable or the federal environment won't work, but I think taking a look, I think we need to be proactive in looking at what the needs are in New Mexico, what our systems are, and where we're spending our public dollars, so that we can use our resources most effectively.
So the first part of that Health Security Act would be looking at Medicaid, how much money state employees spend for health care, and just getting a whole picture of where, a snapshot of what our expenditures are, how much is private, how much is through one form of government or
and
another.
could we develop a better system where that's more of a single system, so that you don't have the administrative burden of multiple insurance carriers and multiple rules, and that small businesses could invest in, and for a more effective healthcare system? And I'm not sure, but I think it is incumbent upon us to look really closely at how we're spending our dollars and where we could potentially have cost savings if we have to tighten our belts even more. If Medicaid is reduced, for instance, how do we continue to provide care for all those folks and all of our public employees, using our dollars the most effectively we can?
Well, I think one of the concerns that I have, and I've seen this in my community, where we are covering those individuals that have not had health care previously, and I appreciate that, and I'm glad we expanded Medicaid. But what's happening to those that kind of fall in the middle? I'm on Medicare and I have a supplement and I pay a pretty high premium for that. But those people in the middle that don't belong to a particular group, they are paying extremely high premiums, right, and they basically have no health care because they're out-of-pocket expense, and that cost to them makes it impossible for them to even access care. They have major medical if something really severe happens, but actually the people that are on Medicaid are getting better health care service than the individuals that are paying the high premiums. So that's something that we need to look at as well.
And those middle people that fall in,
Exactly.
The only way they can afford it is by having huge deductibles.
Huge deductibles,
and
which
that's
is
not a good thing.
Yeah, it's hard to get past that. Having to pay $5,000-$6,000 out of pocket before your insurance kicks in.
Exactly.
It's almost like having nothing.
It is. And so I think there are two sides to it. And certainly when people talk about access, when we expanded Medicaid, we don't have the physicians in this state. We don't have the primary care providers that we need. In fact, I'm doing a bill that hopefully will help recruit and retain those doctors. But that's a major problem. And it's not just in New Mexico. I think it's nationwide. We don't have the providers to provide. And the wait times are long, not just for the Medicaid patients, but for every patient that has to access a physician. Sometimes the wait can be 2 to 3 months.
So building up our workforce, incentivizing providers of all kinds, of a full spectrum of providers, to be in New Mexico, stay in New Mexico, and particularly serve the rural and underserved areas, I think is a key
Critical.
issue. It's critical.
Now, Gay, Senator Kernan, you have your educational background, so you serve on the Legislative Education Study Committee in the interim. You also serve on the Health and Human Services Committee, but you have a new committee that you're on, the really challenging, the Senate Finance Committee. So that is really where the rubber hits the road in this time of challenging economic times. What has that been like for you?
Well, I think that by serving on the LESC and Senate Education, and also serving on Public Affairs and Health and Human Services, I certainly understand the challenges that we face with regard to financing both of those, whether you're talking about our schools or whether you're talking about Medicaid and health issues. But what I'm learning as a member of Senate Finance now is the broader picture, because we're hearing reports from all the departments, all the agencies, and there is such great need across the board. And when we talk about how we impact children when we have to cut schools, it is an impact. But I will tell you, when we cut the judiciary, we are impacting children as well. And I've learned that through the presentations. We've lost a wonderful guardian ad litem in Lee County because her contract was cut and she simply cannot afford to serve, so they've had to go out and find someone else. Our CASA program has been cut, our DWI program. All of these things are outside of the public education funding, but they impact children significantly. So by serving on Senate Finance, I'm learning that it's got to be more than just about education and about health care. We're talking about safety and the judiciary and all across the board, how the cuts hurt.
Mm-hmm. I would agree, and I think that part of the cuts, not just to funding external programs, but cuts to the departments themselves, have had an impact. And I particularly look at Department of Health and the cuts that they've made in staff to do programming or to provide oversight of licensure of facilities. And I think then that impacts vulnerable adults and children when you have not adequate staff in CYFD or not adequate staff in DOH to oversee where their areas of responsibility is, or cuts to the facilities that the state runs. And so it's internal cuts as well as the funding that we do to other programs.
Yeah, well, I remember Lucky Varela sitting here, and he was head of appropriations and finance for years, and he just looked at me and said, Lorene, if you're going to keep milking this cow, you're going to have to feed it sometime. And I think the departments have done very well. Belt tightening is no longer a metaphor. There's, it's way too tight. We know there's little bits that can be cut, but the overall picture is really worrisome.
Mm-hmm. I know that the chairman has mentioned that we cannot tax ourselves out of this problem that we have currently. Not to say that down the road we certainly, and even maybe in this session, look at opportunity to find ways that we might consider a tax increase in some point. But those taxes won't help fill the hole that we have currently, and that's going to be the problem. So the only thing that I can think of, I'm seeing a lot of swapping and switching around and trying to make do with what we have. The encouraging thing is, and I know that there's some opposition to oil and gas, and I know that people feel differently one way or the other, but things are definitely improving in our area. A lot of investment has been made, and we know that things are going to get better, but we have to learn how to handle that revenue in a different way, and that's what I hope we can do in the future.
I agree. Any revenue enhancements that we look at don't help us for the immediate shortfalls.
Yeah.
That takes time for that revenue to come in. So while I think we need to look at those things for longer term, it doesn't fix this year's
Right
budget.
now.
It doesn't fix probably even next year's budget because they take time to enact and then to realize that revenue.
Yeah. I'm one for closing the loopholes. We give a lot of exemptions to people, and a tax expenditure budget that looks at who's getting the exemption and are we having a return on investment. But again, that doesn't solve the immediate problem. So you guys, you ladies, are in a really hard session right now. And I know that Senator Smith had put out a pronouncement yesterday on the floor saying, we got new revenue projections coming in, which may be here by the time this airs. But whatever it is, we still have to, do our current fiscal year, do next fiscal year, and then try to get something in the reserves.
Exactly.
Right.
So
Right.
it's very
Right,
challenging.
because if we don't build the reserves back up, our bond rating goes down, which has a negative impact on the economy too.
Yeah. Well, we're speaking today with Senator Gay Kernan, Republican from Hobbs, and Representative Debbie Armstrong, Democrat from Bernalillo. Thank you so much. Let's look at some of your individual issues that we're going to start with you because as chair of the health committee, you are carrying a huge amount of health bills, some of which have been getting a lot of attention. I watched, and I urge our audience to go to nmlegis.gov and watch these proceedings. You have a bill called Aid in Dying that was hours of the most emotional, powerful testimony. And so where does that stand now? It's called HB 171.
171 End of Life Options Act, and this is for medical aid in dying for an adult who is terminally ill and is decisionally capable, so they have competence and capacity to make a decision for themselves, and the ability to self-administer medication. So it is for someone who is facing the end of their life and who may be suffering from intractable pain or fear, and it's a very emotional thing. It's a very personal choice, and I think that's for me. It's for people to have autonomy and control about the end of their life. Most people who've used this in other states like Oregon are in hospice. They're getting, and most have gone through all sorts of treatment, and it's done. There's nothing more to do, or they've just had enough, and they're facing the end of their life, and it's an option for them. It's personally important to me, and I'm going to say I have been the direct caregiver at the end of life for a number of friends and family. Today, on Valentine's Day, when we're airing this, is the anniversary. The 8-year anniversary, I think, of a very dear friend who I slept at the foot of her bed, set my alarm to get up and continually give her morphine so that she didn't have to die in excruciating pain or suffocation from her just not being able to breathe from what was in her lungs. And I have a daughter with cancer who is fine now, but at some point she might not be. I would never want her to feel like if she wanted this choice that she'd have to do it alone and not involve her family and her friends just because she didn't want us to get into trouble.
Exactly, because the way the law is now, this is a decision the patient has to make, and if they do receive aid in dying until we come to an understanding of what this bill is about, they have to secretly do it at a time when you need the most support. You're trying to protect your loved ones.
Or stories of people who have, at the end of their life, picked up and moved away from family and friends to be able to go to some place like Oregon, or now they could go to Colorado.
Yeah.
But then that means settling in somewhere, finding a doctor, all of that stuff at the very end of their life, and not being in their home.
And with their family.
Yeah. So
It's a very emotional and still controversial area, but
it's not for everyone. And it's not used actually a lot. A lot of people who actually ask for the medication don't end up using it. But it's such a relief knowing they've got that option if they need it, if it gets too bad. So.
And in your work with the Interim Health and Human Services Committee, you were there through the whole behavioral health problem where we had a system in place. It was just stopped in its tracks. A lot of people lost care. Can you give us an update on what's happening? I know it's still in flux.
It is, and I believe that, as you know, many of those behavioral health organizations that were in place, that were removed, now we're finding out that They should not have been. And so I think they're in the process now of negotiating with the Department of Health and Human Services to figure out how to reimburse them for those services that they did provide. So that's still in flux, and it's one of those times that were very difficult for those of us that sat on the committee and kind of observed all that. But fortunately, we do have, I think the federally qualified health centers are now picking up, and they're doing some work in my area, which I'm very grateful for, I think in the Artesia area in Carlsbad and Roswell. So people are filling in, and they're doing the things that need to be done. So
you, another controversial bill that you are carrying, this made such sense to me. I would like to acknowledge your daughter, Erin, because she is named in the Lynn and Erin Compassionate Use Bill from, 7 years ago, 6 years ago?
More like 10.
10, that allowed medical marijuana to be given to patients who qualified. And you were wanting to take some of the proceeds from the sale of medical marijuana and put it into a research fund.
Yes, so
Am I
it's
saying that
taking, yes, my proposal is to take some of the fees that are paid by the producers of medical cannabis and divert that to a fund that can be dedicated to research. We constantly, and the research is a whole variety, whether it could be how to grow the plants appropriately, the right kind of soil and pest control, all the way to effectiveness and use and dosage and strain for someone for a variety of different conditions.
I think that's a good way to spend that, spend those funds, and I supported the medical marijuana bill, and I think probably the only concern I have is I don't think that it's necessary with regard to the rapid expansion, and so I like the initial bill. I supported it. In fact, I know of situations in my own community where there are people who are receiving great relief from receiving the medical marijuana in a form that doesn't create a particular high feeling.
Right.
And so those are the places where the research needs to occur, because the medicinal part of that is very helpful for people that are in pain and need that. But I do worry a little bit about the rapid expansion of usage on that, but certainly think the best thing to do is research that.
And one of the, I don't know whether it was an unintended consequence, but it's been a really good benefit, that there's a nationwide epidemic of the overuse of painkillers and Oxycontin and things like that. And that patients who can take the medical marijuana can actually get surcease of pain from that, as opposed to these heavily addicting, very powerful pain pills.
And I've actually had some feedback from physicians who work in pain management who, because it's still illegal under the FDA and there isn't any research, they're uncomfortable with formally using it as a diversion, but they see it happening in their patients, and they're very interested in participating in research and the potential use of medical cannabis as instead of opioids, and to try and help someone who has addiction to get off those dangerous medicines.
And I think we all agree that that's a tremendous problem in the state of New Mexico, and certainly the formation of the online pharmacy board site where physicians actually have to sign in and check to see what their patients are taking. And my husband has been, he has a difficult time sometimes getting on and taking care of that. He doesn't have many patients that require that, but he does have some, and the rules continue to get stricter. They are more strict now than they were before, which I think sends a message to physicians to try and find an alternative before you go down that road of prescribing the opioids. And that's the purpose of it, and I think that was a good thing.
Yeah.
Contraception. You have put it, we're going to have to go lightning through these bills really quick. That access to contraception, whatever happens on the national level with the Affordable Care Act, would be protected for women in New Mexico.
Yeah, so I've put in a bill that would provide full access to all forms of FDA-approved contraception. with no cost sharing. That's currently provided under the Affordable Care Act, but because we don't know what's going to happen to that, I would like to protect it in state law, because I think it makes sense for the health and well-being of women and families. More than 2/3 of the babies born in this state are on Medicaid, and we have a high teen pregnancy rate. And if we provide good access, free access to contraception, I think that we can really decrease unintended pregnancies. And so I want to maintain that effort, regardless of what happens federally.
Do you have a bill? We've got 2 minutes left.
Well, I want to talk a little bit about a bill that's related to health care, and it's the loan repayment for physicians. And I went to the board and medical board and solicited their support, and we came to an agreement where half of the additional fee would go to the loan repayment piece, and we're going to establish an excellence fund for physicians where that money is funneled in there. We can get more physicians to come to New Mexico and help them with loan repayment. The other half, $50 of that licensure fee, would go to Impaired Physician Fund, which I think the board is in great need of, because we've got good physicians that sometimes fall astray, and we need to bring them back into the fold, and that's going to be very helpful. So I'm hopeful that that bill will pass and we can get that going.
Well, we'll be watching it. Really quick, the surprise, you'll both love this, the Surprise Billing Protection Act. When you get your bill and it's like $500 for an aspirin, how's that going?
Well, it hasn't had its first hearing yet, and it's really meant to protect someone who thinks they're going to an in-network
That's right, the
hospital or
neonatal-
emergency
the
room.
neonatal kit.
Very important.
And then what happens is they may get, whether it's an anesthesiologist, ER doc, or some other service who's not credentialed on the network, covered by their carrier.
Extremely important.
And then
bill.
they get that surprise bill because it's out of network, and they thought they were going to an in-network provider.
That happened to my daughter in Austin, and I will tell you that is really not fair, and we need to do whatever we can, and I will take a good look at that and anything I can do to help.
Good. One last biggie that I'm sorry we're getting into it at the end of the show, the board and care regs for some licensing for board and care homes.
So there are a number of homes usually serving those with mental illness who currently don't fall under oversight by Department of Health licensing. And so I'm trying to create a framework where they can register with the Department of Health so we know who they are, and local communities, local counties or municipalities can adopt some model regulations and oversee them more directly.
So I want you to come back and tell us at the end, what Senate
happened?
Finance, how that has altered your perspective. But I'm really happy that you can take all of your health and education background and now look at the
Big picture.
the big stage where the rubber hits the road. So thank you for your work. And you've got all these health bills. Thank you so much for your dedication and shepherding them through. I know.
Thank you for having us on.
Thank you very much, Lorraine.
Well, our guests today are Senator Gay Kernan. Thank you. And Senator Debbie Armstrong. Representative Debbie Armstrong.
Although I would be happy to join.
Well, maybe you will.
Representative
Maybe you
Senator.
will. But you both have worked so hard. And on behalf of a grateful state, I say thank you for joining us here and thank you for your work.
Thank you very much.
And I'm Lorraine Mills. I'd like to thank you, our audience, for being with us today on Report from Santa Fe. We'll see you next week.
Report from Santa Fe is made possible in part by grants from the members of the National Education Association of New Mexico, an organization of professionals who believe that investing in public education is an investment in our state's economic future, and by a grant from the Healy Foundation, Taos, New Mexico.